Hello, Dr. Roxy Barber here. I practice integrative medicine and aesthetic medicine here in Fort Lauderdale, Florida. And we do a whole plethora of treatments at my office. And one of the things we do a lot of is lab testing. We work with a lot of specialty labs that we can get some really cool testing and results to find out what's going on in someone's body. And we also work with the traditional labs like LabCorp for the more routine labs that we offer. Our sister company, Rockin HRT, we utilize labs as well for where we offer peptide therapy, testosterone therapy for men, and functional nutrition via telemedicine, and we also offer it with Roxy Barber Acupuncture Aesthetics as well. So we do a lot of testing for nutrients. So there's two different types of testing that you can do to find out what nutrients you are deficient in. One is serum testing, which is more of the traditional testing. If you get your routine labs done, a lot of times doctors will test your B12 and your omega and vitamin D. So here's the problem with that. It's kind of a glimpse on what has been floating around in your blood for the last 2 or 3 days. They're testing the serum, the fluid that your cells float around in. One of the tests that I use a lot is intracellular micronutrient testing. So that test actually goes inside the white blood cells to see what's actually getting in the cells. And that's where all the biochemical reactions in the cells happen. That's where these nutrients have to go for anything to happen. The analogy I like to use with my patient is you can go to the gas station and you can put the gas pump next to your car and you can pump gas all day long. But if it's not going in the car, into the car's fuel cell, it's not going to do anything. It doesn't matter how much is out there. It's all about what's getting in the car. Same with our cells. It's all about how much is getting into our cells. We can have plenty of it in the serum of our blood, but maybe it's not all going into the cells. And that's something we'll also look at. Maybe it's because our cell membrane needs detoxing, because sometimes we get this toxic layer around it. And then what we need to go in the cell with osmosis isn't able to. So you can have enough nutrients extracellularly, but if they're not going into the cell, you can be intracellularly deficient. That's why sometimes people that do intracellular testing, it might show they're deficient in, say, vitamin B12, but then their serum test says, whoa, you got a lot of it. But then we know that it's not going in the cell. So I personally think that the serum testing doesn't really give us a great look into what's going on. I would rather look into the white blood cells. One, you don't have to fast for that test because it's not going to change with what you've eaten. So our white blood cells stick around on average for about 6 months. So when we look inside the white blood cells and look at the levels of nutrients, we're really getting like a 6-month history of what's getting in there, not what's in your serum. You know, you can eat an apple and that'll change. So, and we know it's getting where it needs to go for the reactions inside of the cell. What else is really great about that test is once we do the test and we go over and come up with a plan, whether it's are you going to get certain injections or IVs or supplements or herbs and food therapy, how are you going to eat, what you're going to incorporate more of into your diet, what you might take away. We come up with that plan, and this test, you won't need to do it again for 6 months. And there's really no point. You don't want to test a month or 2 months later. We want a full turnover of your white blood cells. So a lot of people will just do this test in my office every 6 months. And that way they can always make sure they're hitting the mark for all their nutrients. The other thing with this test is I have a lot of people that will come in with a huge list of supplements they're taking from this place and that place, and Dr. Oz said to take this one, and Dr. Phil said take that one, whoever, an article they read. One, when we do this test, I can find out there might be a lot of those supplements that people are taking and they're not working. So we know that's not a good supplement for your body. It's not working. Stop wasting your money. Or we also know, hey, you're taking 30 supplements every day, but you're missing the mark on a bunch of stuff. A lot of times I end up saving people money with the supplements they're taking because we know exactly what they need. We know exactly what they don't need. And I know how to get them on as few supplements or injections or IVs as possible to get the best results. And then we can kind of play with it. And my patients that do these tests regularly and keep all their micronutrient levels where they need to be rarely get sick. They feel great, their brain, their cognition is great, their vision's great, they recover faster if they're working out, they sleep better, their stress is better, everything's just better because we have everything we need. When you have that car, if you don't have enough gas, if there's not oil in the car, if there's not coolant in the car, or not enough of this stuff, eventually you're gonna have a problem and you're gonna break down. And our bodies are the same way. So we also have a whole other gamut of tests that we can run. We have tests where we can check to see if you have heavy metals in your body. We can see how your neurotransmitters are working. We have tests to see how your immune system's working. We do testing for allergies. And a lot of times food sensitivities, that stuff can change constantly, especially if you're eating a lot of the same food. And that can cause inflammation, it can cause weight gain, it can cause depression. There's so many things that can cause that. When we look at that and can kind of alter how we're eating and our lifestyles, we can start to feel much better that way as well. And a lot of times I'll have my patients that are in pain or having a lot of GI issues or depression. Let's look at this stuff because it all works together. We have different tests as well for, we do some genetic testing, whether it's for why are you losing your hair or how are you methylating, which is, we'll explain that one if you might need it. Pretty much everything you can test for, we can test, or anything you'd want to be tested for, we can test for. And we can test to see if someone has parasites, or we can test to see all your basic blood work, how your omegas are functioning in your body, how your antioxidants are functioning in your body, which antioxidants you should capitalize on because your body likes the best. We can check your telomere testing to see how long your telomeres are, to see how your body's aging. The list just goes on and on and on, and there's some really cool stuff that you can do. We offer hormone testing, and we work with male hormone replacement therapy with our sister company, Rockin HRT. So we would love to have you in to chat about this. If you're interested, we offer free consultations. You can call or text our office, or you can book online at roxybarber.com. Emails only checked once a week, so that will be a much slower response, so we encourage you to do the other options. And if there's someone that you think we might be able to help, we would love for you to refer us to them, send us this video, let them know you did, because we want to help as many people as we can. We want people to stay healthy, we want them to stay off of medications, and we want them to feel good, and we want them to age gracefully and feel good while they do it. So hopefully we get to see you soon, and I appreciate your time in watching this, and have a great day. Thank you.